Hello everyone, I am Dr. Sharath, consultant paediatrician and neonatologist at Bloom Hospital, Kompally. In this video, I will be sharing some of the tips for new parents about breastfeeding. Breastfeeding is a natural process and it is a activity of the child which helps to develop the bond between mother and the newborn. So many of the new mothers are concerned whether they'll be able to breastfeed the child, what is the correct position, how do I know if my breastfeed is sufficient for the child, and are there any tips to establish the breastfeeding faster. In this video, I am going to share some of the tips regarding breastfeeding. These tips will help new mothers to be more comfortable and at ease while breastfeeding. First is be comfortable and confident. It's very natural for a mother to be anxious and worried while breastfeeding the child. But trust me, you need to be more comfortable if you want to give a good breastfeed to your baby. So select a calm and well lit place in your room. Be relaxed. Stretch your back. Then start the breastfeeding. If the baby is crying continuously, you can keep your finger in the mouth of the child, allow him to suck for some time, and then position the baby to breastfeed. Second tip is breastfeed as often as possible. This allows mothers to produce lot of milk because the sucking of the baby stimulates certain hormones in your brain and tells your breast to produce more milk. So as often as possible, give your baby your breast milk. There are two main components in breastfeeding. One is position and the other is latch. To give a comfortable position to your baby, there are certain basic requirements. Firstly, the baby should be as close as possible to you. Then you need to support the baby's head with your hand, baby's whole body and back with your forearm, and you need to support the back of the baby also, so that the baby is in full control of your hand, and the baby should be turned towards your side. The face of the baby should be towards your breast. The baby's chin should touch your breast, the baby's tummy should touch your tummy, and the baby's leg should be towards your back, so that the whole baby should be around you. Help your baby latch. I'll be showing you the photos regarding what is a good latch and what is a bad latch. In a good latch, the areola, that is the outermost hyperpigmented area around your breast, should be as much as possible, the areola should be in mouth of the child, so that he'll be able to express the milk from the breast. Only if the nipple is in the mouth and if he is away from the breast, then that is not a good latch. To call it a good latch, the baby's mouth should be wide open, his lower lip should be everted, that means it should be outward like this, and his chin should be touching your breast, and most part of the areola should be covered by his mouth. The lower part of the areola should not be visible. So this is called a good latch. Good latch will help mothers in preventing certain nipple issues, cracked nipples or fissures in the nipples. These kind of issues can be prevented by helping your baby to give a good latch. How can you give a good latch to your baby? Before breastfeeding, gently massage your breast. Then express little amount of milk and put it in the mouth of the baby. So when the baby opens his mouth wide, then point the nipple towards nose of the baby and put the baby to your breast when the mouth of the baby is open, so that complete areola will be covered by his mouth. By sucking on the areola, the baby will be able to express milk, and you will be able to see the baby sucking, and you will be able to listen and see the baby swallowing. That means the baby will be able to swallow your milk. బిడ్డ పడుకొని లేవగానే కొన్ని క్లూస్ ఇస్తుంది మనకు, దాన్ని బ్రెస్ట్ ఫీడింగ్ క్లూస్ అంటాం. ఇవేమైనా క్లూస్ కనబడగానే మదర్ షుడ్ స్టార్ట్ ప్రిపేరింగ్ హర్ సెల్ఫ్. బ్రెస్ట్ లైట్గా మసాజ్ చేసుకొని కంఫర్టబుల్ పొజిషన్లో కూర్చొని ఒక పిల్లో సపోర్ట్ కానీ లేదంటే బ్రెస్ట్ ఫీడింగ్ పిల్లో కానీ యూజ్ చేసుకుంటూ ఫీడింగ్ ఇవ్వాల్సి ఉంటుంది. సో ఈ క్లూస్ ఉన్నప్పుడు బేబీ ఫస్సీగా కాకన్నా ముందు, బాగా క్రాంకీగా కాకన్నా ముందు, బేబీ ఫీడ్ డిమాండ్ చేసే కన్నా ముందే ఏదైతే ఈ క్లూస్ ఉంటాయో ఆ క్లూస్ బట్టి మనం ఫీడింగ్ స్టార్ట్ చేయాల్సి ఉంటుంది. సో కొంతమంది పిల్లలు లేవగానే ఒళ్ళు విరుచుకోవడము, నోరు చప్పరించినట్టు చేయడము, నాలుకతో పెదవులు తడపడము, ఫీడింగ్ తీసుకుంటున్నట్టు సక్కింగ్ సౌండ్ చేయడము, ఇలాంటివన్నీ బ్రెస్ట్ ఫీడింగ్ క్లూస్లోకి వస్తాయి. సో ఇది ఒక 5 to 10 minutes ఉంటుంది. ఈ సమయంలోనే మనము బేబీని తీసుకొని ఫీడింగ్ స్టార్ట్ చేయాల్సి ఉంటుంది. సో దీస్ ఆర్ ది ఎర్లీ సైన్స్ ఆఫ్ బ్రెస్ట్ ఫీడింగ్. ఒకవేళ ఇది దాటాయి అనుకోండి, బేబీ బాగా ఫస్సీగా అయిపోవడము, బాగా క్రాంకీగా ఏడవడము, డిమాండ్ చేయడం జరుగుతుంది. ఒకవేళ ఈ టైంలో ఫీడ్ చేద్దాం అనుకుంటే బేబీని తీసుకొని మన ఫింగర్ బాగా క్లీన్ చేసుకొని బేబీ నోట్లో పెట్టి కొద్దిసేపు బేబీ ఫింగర్ మీద సప్పరిచ్చిన తర్వాత కొంచెం కామ్ డౌన్ అయ్యాక మీ బ్రెస్ట్కి ల్యాచ్ చేసుకోవడానికి పెట్టుకోవచ్చు. సో దెర్ ఆర్ డిఫరెంట్ పొజిషన్స్ ఇన్ బ్రెస్ట్ ఫీడింగ్, but in all of them the concept is same. You need to support the baby as much as possible. It should be very comfortable for the baby to latch on your breast. To do this, the baby, you have to support the baby's whole body, and the baby should latch on your breast completely. As shown in the screen, there are different positions. So different positions are comfortable for different mothers. So you need to select which position is comfortable for you. If you are having twins, you can give them in a football position. Like you are holding a football, you can hold the babies on both sides, have a pillow, then you can keep them like this and feed them. So and do not panic while breastfeeding. If you are in panic, if you are in stress, your outflow of milk will be affected. And try to breastfeed at nights. Night feeding will help release certain hormones from your brain, which tells your breast to produce lot of milk for tomorrow. So don't avoid feeding at nights. Always feed the child at nights. While breastfeeding, dress your baby in a comfortable clothing. Don't swaddle him. Please open the child, make him comfortable, and then try feeding the child. Do not use pacifiers. Pacifiers are enemies for your child. Why is it so? When the baby is growing, it increases the chances of baby having abnormal teething. And the other thing is, normally in babies who are using pacifiers, there is lot of infection, diarrhea and stomach pain and aerophagia. That means they swallow the air, and that causes lot of flatulence, gas passing, and lot of pain abdomen in kids. So do not use pacifiers. Ask for help. You can consult a lactation specialist, lactation nurse, or even the doctor. Do not hesitate to ask for help. There is a myth surrounding breastfeeding. Some of my parents tell me my mother did not give breast milk, so I may not be able to breastfeed my child. That is not correct. It is a very natural way of feeding the baby, and trust me, you can do it. And it is a very easy approach. The only thing is you need to be confident and you need to be comfortable while breastfeeding your baby. Thank you.